Are we ready?
Yep.
Shooting? Alright. Bowen has kindly agreed for us to use his knees today to demonstrate laser treatment on the knee. Bowen has recovered from 5 knee surgeries, and his last knee surgery was quite challenging, and so he was looking for a different form of physical therapy treatment in order to speed the healing. Laser, when applied with enough power, can actually penetrate 3.5 inches deep into the tissue. So when it comes to a knee or a hip, having a more powerful laser approach is much more effective because we can penetrate deeper effectively. We're going to deliver 40 watts of power today, and we're going to deliver those joules of energy so deep that it helps the knee recover from the inside out. And of course, this is all about his ability to heal himself. This turns on the healing mechanisms, turns off the pain, and also turns off inflammation. So in Bowen's case, he was able to do his physical therapy more effectively and in a lot quicker manner to restore his joint play. His surgeon was happy with it, his physical therapy was happy. Matter of fact, he was discharged to do his own physical therapy because he was doing making such good progress. So we'll have Bowen talk a little bit more about his recovery from his surgery as we do the treatment today. Before we get started, just one of the things to consider with laser from a safety point of view is that you always want to wear the appropriate glasses, goggles, in order to keep eye tissue from being affected. Other than that, as long as the lasers are applied effectively and thoughtfully, it gives a nice warming sensation, and the patient's comfort is usually it feels quite nice. So we apply the laser in a gradual fashion here. Our goal is to saturate the tissues with joules of energy. This is done at a 900 plus wavelength, which is known to have a very positive effect on turning off pain, turning off inflammation, and causing the mitochondria to produce ATP, which is our little energy packets. Some of the ATP is used to warm the tissue and excites the water molecules, and other portions of the ATP is used to create a quicker healing response, up to 3 times quicker healing response in injured tissue. So Bowen, tell us a little bit about your recovery after the 5th surgery.
Following the 5th surgery, which was a 2-piece bone graft into my femur, secondary to a patellar reattachment, patellar tendon reattachment. I immediately following the surgery, I was on a CPM, a leg movement machine.
Continuous passive motion.
Yes, continuous passive motion. It was about 10 hours a day, so sometimes at night, sometimes in the morning, just because my body develops scar tissue really fast. So we wanted to keep the joints in motion to discourage that from happening and slowing down the healing process and limiting the range of motion. So I used the CPM machine for several months, and it did what it was supposed to do, and from there I transitioned to manual physical therapy and made a decent amount of progress. We got the knee to move roughly, it was like 88, almost 90 degrees of flexion, but it would just kind of reach this solid end stop in the range of motion. And then we just got to a place in time where the progress was slow, if any. So I decided to switch to laser therapy. And after the 3rd or 4th visit, I noticed immediate results just from when I went into the office to leaving the office, just walking out to my car.
That's exciting.
Or limping out to my car afterwards. It felt more normal, felt lighter, freer range of motion, and the shape of the knee started to return back to normal too. Some of the stored tissue and scar tissue got smaller.
So we've had patients tell us over the years, or last few years as we're using laser, that they feel like their tissue is melting, which of course it's not. But I think what you're describing there is the ability for the body to regenerate that tissue into a better style or type of tissue that's more workable with your physical therapy. And what was the first thing you noticed that you could do at home over a home-based physical therapy that you weren't able to do but could really show your progress in your recovery?
The initial thing was pedaling a bicycle. You know, at first it was difficult to make a full rotation with the pedals on the bicycle. I had to have the seat very high. And after I started the laser therapy, I could move the seat down and force my knee into a smaller angle and get more flexion out of it. And that was noticeable quickly after the first couple weeks of therapy.
Fantastic. So where your physical therapy by itself had left off, where you could only get to 90 degrees, you bypassed that with your own home physical therapy with the help of the laser, helping your body help itself.
Yes.
Which is kind of neat because it's really not the laser's credit, it's your body's ability to heal itself that we're just kicking into fast forward and helping it recover in its own manner. Do you know what your final range of motion was when you're fully recovered?
I don't know the exact number, I guess somewhere around 105 degrees.
Congratulations. Nice to have your ability to do those quality of life things back. You've been riding your dirt bike again?
Yep.
Not back on that horse?
Riding the dirt bike as much as I can. That's the small things, like being able to sit Indian style on the floor, being able to cross my legs comfortably.
That's what it's really all about, is the quality of life, and of course pain reduction and not having to have pain when you're doing a chronic lifetime pain, which is because it also affects you at work, right? You're on your feet a lot during the day.
Yep, I'm on my feet all day, moving around, lifting, going up and down stairs. It makes a really big difference.
Well, over a short period of time here, we will see as we deliver these joules of energy into Bowen's knee area that he will start to pink up and the tissue feels warm and begin to relax. Very comfortable treatment for the patient. Actually has a nerve system stimulation where it almost delivers a bit of an endorphin effect on the central nerve system. So thank you for doing this with us today, Bowen. Hopefully you've influenced other people in learning more about lasers and how they can help their recovery.
Yeah,
look forward to 50 more years of good health with you.
Yeah, my only regret is that I didn't start doing it sooner following the surgeries. I shouldn't have waited quite so long.
Well, we'll have to teach your surgeon about lasers.
Yeah.
Thank you, Bowen.